everyone, my name is Sally. I'm a physiotherapist and clinical Pilates instructor based here in Sydney. In today's video, we're going to break down a super important topic for Pilates instructors, the normal alignment of the shoulder girdle. This is especially helpful if you're new to anatomy, Pilates beginners, or working with clients who have had shoulder pain before. Understanding proper alignment helps you to teach safer, smarter, and more effective movement. So, let's start with the basics. The shoulder girdle is a group of bones that connect your bone to the torso. It includes first, the scapula, the triangular bone on your upper back. Second, the clavicle, which is your collarbone that runs from the chest to the shoulder. The last one is the humerus, the upper arm bone here. These bones work together to support your arm and shoulder movement. As Pilates instructors, knowing what normal alignment looks like helps to support our clients better in movement. Let me show you a quick example. Look at this posture. You will notice the head is sitting forward and the upper back is slightly rounded. It might not seem like a big deal, but this small shift affects how muscles behave. Some might get tight and overactive, like your upper traps, while others might get weak and underused, like your deep neck flexors. So why should you care about the alignment in Pilates? First, it helps muscles work better. Muscles work best when the bones are in the right place. A well-aligned scapula gives the rotator cuff room to stabilize the shoulder. If the scapula tips forward or downward, the rotator cuff has to work harder and might get overused. For example, in swan prep, if the scapula tips forward, clients may overuse their upper traps instead of using their serratus anterior and lower trapezius. And second, it improves movement quality. Lastly, when joints are out of alignment, muscles start compensating. This can lead to shoulder impingement, rotator cuff strain, and neck or shoulder tension. This part confuses a lot of instructors. Firstly, the glenohumeral joints. The shoulder joint allows shoulder flexion, extension, abduction, adduction, external rotation, and internal rotation. However, the scapula moves on the rib cage. The movement includes scapular elevation, depression, protraction, retraction, and upward rotation and downward rotation. Here's what to look for in a neutral position. The scapula lies between T2 to T7 vertebrae, and it's about 3 inches from the spine. Normally 3 to 4 fingers from the spine to the shoulder blade. And it lies flat onto the rib cage, which is not winging. And it's angled about 30 degrees forward from the frontal plane. And this plane is called scaption. And there is a slight upward rotation around 10 to 20 degrees. Before we talk about the humerus normal alignment, we always assess the humerus after checking scapular alignment. In neutral, the humeral head should sit nicely centered in the glenoid, and only about 1/3 of the humeral head should be in front of the acromion. Common issues are anterior glide, superior glide. The shoulder girdle sits on the thoracic cage. So if the thoracic spine is stiff or misaligned, shoulder function will be affected too. In normal thoracic spine, as you can see from the image, it's slightly kyphosis, which means gentle backward curve. However, thoracic spine can be hyperkyphosis, so increased backward curve, or scoliosis. So here's your takeaway. Before cueing arm movement in Pilates, always check alignment first from the thoracic spine, scapula, and humerus. Starting from a good base means safer and more effective movement. And in future videos, we'll break down specific scapular misalignments like winging, tipping, and downward rotation. And of course, we're going to talk about how to correct them with Pilates. So, don't forget to like, subscribe, and turn on notifications. And I will see you in the next video. Bye!